We know that there's current literature regarding transanal TME compared with open and laparoscopic surgery. What's your view on this literature at the moment?
Well, that's really interesting because we've seen some excellent reports recently. We've also seen a publication with the first 720 cases from the International Registry. And of course, we've seen good perioperative outcomes, good oncological outcomes, good pathological outcomes. So we can say that it's a safe procedure, but the question is, rather than is it equivocal, what bits can we do better? Because that's the idea here, to try and do a difficult operation, but do it better.
And how do you expect the current programme to deliver these advances in technology that you allude to?
Well, when we look at the recent meta-analysis, one of the concerns that has come up, and does come up in much of the controversial points about transanal TME, is the morbidity. And in this paper, we've seen up to 40% in morbidity, albeit the majority being Clavy and Dindo 1 and 2. But yes, of course, there are concerns when you introduce any new procedure. And perhaps now is the time that we start thinking about a more standardised introduction of a training programme whereby not only can we address the safety concerns, but we can also think about improving the general standard for everybody.
And how do you feel these technological advances can help us deliver a training programme?
Well, of course, one of the most successful programmes that we've seen in recent years, particularly in the UK, has that been of the LAPCO programme. And perhaps that's the model that we need to go down, with a preclinical followed by supervised clinical phases of training, and then assessing with unedited videos. So this is something hopefully that we're going to be involved in the very near future.
Yeah, I think that's a good platform to build on. Do you think there's any advances in technology at the moment that we could use to build and further improve that training programme?
I think there are, because if we look at the history of transanal surgery, we've seen that it's been technology that's really driven the procedure forward. And the current platforms that we use, the flexible platforms, came from the previous rigid ones. The instruments that we use are modified instruments, the use of high flow insufflators. And I think the latest and most exciting thing that's coming down the line is the new intuitive surgical Da Vinci SP. And when you see the presentation later, you can see that this single port platform is ideal for transanal surgery. So it is a difficult procedure and there is a steep learning curve. And much of that comes in terms of manipulating the instruments in a small space. But of course, if you've got a robotic platform that can help you with this, that may well expedite the learning curve and make a difficult procedure slightly more easier for the operating surgeon. But of course, we will wait and see what the results show.
Thank you very much, Manish, and I really look forward to hearing how those advances in technology that you've alluded to transpire in delivering a successful training programme.
Thank you very much, and I hope you enjoyed the presentation.